WHO Africa media briefing, which is taking place in collaboration with the APO group. And as always, we'll have some housekeeping tips at the beginning. You can choose the language you would like to hear for the press conference by turning to the globe at the bottom right corner and selecting your preferred language. And remember that we also have a Q&A function in the Zoom application that you can use to ask your questions to our very able panelists that are joining us today. And as you give us your question, remember that you'll also need to give us your name and the media house that you are representing.
Bonjour à tous et merci de vous être connectés pour ce point presse. Nous vous rappelons qu'il est possible de choisir la langue dans laquelle vous souhaitez entendre la conférence grâce à l'outil d'interprétation de Zoom, qui est le petit globe dans la barre d'outils. Afin de poser vos questions, merci d'utiliser l'outil de questions-réponses de Zoom et de préciser votre nom et votre média, ainsi que si vous souhaitez que nous prenions votre question en live. Merci à tous et bonne conférence.
Thank you very much, Francois. So joining us today is Dr. Mashidiso Moweti, the WHO Regional Director for Africa, and I'll now let Dr. Moweti introduce our other distinguished panelists.
Greetings to everyone participating in today's press conference. Bonjour et bienvenue à tous nos collègues de la presse. We're going to be talking about the rollout of COVID-19 vaccines in African countries. I'm pleased to be joined for this conversation by the Honorable Minister of Health of Angola, my sister, Dr. Sylvia Lutukuta, and by Professor William Kabuena Ampofo, the head of the Virology Department at the Noguchi Memorial Institute for Medical Research at the University of Ghana, and also the chairperson of the African Vaccine Manufacturing Initiative. More than 4 million COVID-19 cases have now been reported on the African continent, with 43,000 new cases in the past week and 108,000 lives sadly lost. In the past month, new cases have decreased by 41% compared to the previous month. But there's an upward trend in about 12 countries, including Botswana, Cameroon, Ethiopia, Kenya, and Guinea, where an outbreak of Ebola is also ongoing. At WHO, we anticipate that several countries are likely to experience a third wave in the coming weeks. Governments are easing restrictions, and there is population fatigue, frankly, in adhering to public health measures. And people will soon be traveling and visiting family for Easter holidays in many countries. And some countries have upcoming elections with potential for mass gathering. And also variants are circulating that appear to be more transmissible. Vaccination is the fastest route to social and economic recovery from this pandemic. Through the COVAX facility, more than 16 million doses have been delivered to 27 African countries. This is in addition to more than 9 million doses received through bilateral deals and donations. Around 7 million doses have been administered. 30 African countries have now started vaccination of frontline healthcare workers and other priority groups. So although Africa received vaccines late and in limited quantities, a lot of ground has already been covered in a short space of time. This is due to the time and effort invested in planning and preparing, the continent's vast experience in mass vaccination campaigns, and the determination of its leaders and communities to effectively curb COVID-19. We will hear more about this from the Honorable Minister of Health of Angola. As another example, in Ghana, more than 420,000 people have been vaccinated in just 2 weeks. That covers more than 60% of the population targeted in the first instance in the Greater Accra region, which has been heavily impacted by the outbreak. This is better than some countries which have had access to vaccines for some months. So while the rollout is going well, and we anticipate all African countries will receive their first deliveries by the end of March, some countries have already used up the doses from their first shipments. COVAX supply networks are working hard to confirm the next deliveries. To keep expanding coverage, WHO and partners are supporting countries on detailed micro-planning and running simulation exercises, addressing rumors and misinformation, engaging community mobilizers to pre-list and register priority populations, and reinforcing cold chain and logistics capacities right up to the provincial level. Throughout this pandemic, African countries have faced enormous challenges in obtaining essential commodities like test kits, personal protective equipment, and vaccines due to global supply chain disruptions and even export bans by countries manufacturing these products. We look forward to hearing more about this from Professor Mpofo. This inequitable situation has reignited action to build manufacturing capacities on the continent, and we are collaborating with the African Union, the Africa CDC, UNIDO, or the UN's Industrial Development Organization, the UN Economic Commission for Africa, and other partners to advance this work. And this is where Prof. Mpofo is playing a key role in leadership. International solidarity remains vital, including sharing of vaccine doses by wealthy countries that have surplus supplies, and supporting the COVAX mechanism in its goal of equitable vaccine distribution. Now, in relation to the precautionary suspension of the use of the AstraZeneca vaccine in some countries in Europe, the European Medicines Agency is meeting today, and we expect them to issue a recommendation. WHO has issued an interim statement on this issue. The WHO COVID-19 subcommittee of the Global Advisory Committee on Vaccine Safety is carefully assessing the safety data, and we will soon communicate the findings to the public. What I can say now is that around 17 million people have received the AstraZeneca vaccine in the United Kingdom and Europe alone, and 40 people have experienced blood clotting, and a few of these have sadly died. It's important to note that this rate of occurrence of blood clotting is much lower than would be expected in the general population, as these blood clots are the most common cardiovascular disease globally. So based on the data available, the benefits of receiving and using this vaccine outweigh the risks. I encourage countries, therefore, to continue with the vaccination campaigns and not to pause, as we are in a race against time. The more people are protected, the less likelihood of mutations producing more dangerous variants of the virus, thus endangering the whole world. As African countries have started vaccinating, we've seen more people coming forth in countries like South Africa and Ghana, eager to get the vaccine. I commend those political and other leaders who've come forward to be vaccinated and to motivate their fellow citizens. I encourage everyone who is eligible, when it is their turn, whether they be healthcare workers and other essential workers, older people, those with underlying conditions, to get vaccinated for your sake and for that of our communities and countries. Finally, I was saddened to hear of the passing of His Excellency, the President of the United Republic of Tanzania, President John Magufuli, and would like to convey my deepest condolences to his family and to the Tanzanian nation. WHO stands ready to support the government and people of Tanzania on all priority health issues. So I thank you again for having joined us today, and I look forward to our conversation. Thank you.
Thank you very much, Dr. Moeti. And I still call upon you now to introduce to us the honorable members that have joined us today for our panel.
Yes, as I said, we have been joined today by the Honorable Minister of Health of Angola, Minister Lutukuta, and I'd like to ask her now to share with us the experience and the perspectives of Angola.
Muito obrigada, Excelência, doutora Moeti. diretora regional da OMS para a África, Excelência Sr. Professor William Ampopo, presidente da Iniciativa Africana de Fabricação de Vacinas, digníssimos jornalistas. Permitam-me que comece por agradecer o convite que nos foi endereçado para participar nesta videoconferência e mostrar não só a experiência de Angola, mas também a nossa alegria por termos iniciado a campanha de vacinação contra a Covid-19, este terrível flagelo que atinge a humanidade com efeitos negativos sobre a saúde, afetando drasticamente as sociedades, as economias dos nossos países. Angola recebeu no dia 2 de março, através do mecanismo da iniciativa COVAX, 624 mil doses de vacina da farmacêutica Oxford AstraZeneca, fabricado pelo Serum Institute da Índia, tendo iniciado no mesmo dia a vacinação, cumprindo a fase inicial da primeira etapa do nosso Plano Nacional de Vacinação contra a Covid-19, temos estado a introduzir grupos prioritários. Começamos com os profissionais de saúde, estamos agora a vacinar os professores, pessoas idosas com comorbilidades e forças de defesa e segurança. Até a data já vacinamos 53.515 pessoas, das quais 65% são profissionais de saúde, da capital do país, epicentro da pandemia. A vacinação dos idosos com mais de 65 anos, professores do pré-escolar e ensino primário, também já iniciaram em Luanda e neste final de semana vamos começar com os mesmos grupos em 4 províncias de maior risco e com mais casos ativos. Temos feito a notificação e seguimento de eventos adversos, não tendo sido notificado nenhum efeito adverso grave. Gradualmente iremos incorporar novos atores de grupos de risco, até atingirmos 20% da população a nível nacional, até cobrirmos 6,4 milhões de pessoas maiores de 40 anos, que são os 20% da nossa população, o que constitui a meta da primeira etapa da campanha de vacinação. Com as doses recebidas, infelizmente, o país só poderá cobrir 7,4% das necessidades da primeira etapa, pelo que esperamos, continuamos a contar e esperamos, um apoio da COVAX para o fornecimento atempado das próximas doses. Também realçamos que há esforços do nosso governo para, através de iniciativas próprias e contactos bilaterais, fazermos aquisições de vacinas. Para implementar a vacinação, já foram mobilizadas mais de 1.000 pessoas, entre técnicos do Ministério da Saúde, Ministério da Educação, Polícia Nacional, Forças Armadas, instituições parceiras, como a OMS e a Unicef. Permitam-me que resume os fatores de sucesso. A liderança forte de Sua Excelência Presidente da República, João Lourenço, o comprometimento político do Executivo Nacional, acompanhamento permanente a mais alto nível do Ministério da Saúde e apoio técnico de parceiros, em que destacamos a Organização Mundial da Saúde. Elaboramos precocemente o Plano Nacional de Vacinação contra a Covid, flexível, adaptando-se à disponibilidade do tipo de vacinas, seguindo orientações da OMS em 2 etapas que cobrirão 53% da nossa população com idade superior a 16 anos. Investimos numa cadeia de frio cerca de 3,2 milhões de dólares, criando capacidade de conservação de qualquer tipo de vacina. O registro digital, seguido da devida confirmação eletrônica do vacinado, agendamento da segunda dose e entrega de cartões após a vacinação. Organização de centros de vacinação de alto rendimento com capacidade para vacinar entre 2.000 a 3.000 pessoas, que garante agilidade no atendimento, evitando filas de espera após a triagem. Alta demanda por parte da população-alvo, fruto da mobilização massiva desencadeada em todo o país com envolvimento de todos os setores. Para terminar, reitero os meus agradecimentos e o apoio recebido da COVAX Facility, da OMS, que tem sido um parceiro estratégico incondicional de todos os momentos, da Gavi, das agências dos programas das Nações Unidas e de outros parceiros de cooperação internacional. E reafirmo, mais uma vez, o comprometimento de Angola na melhoria dos indicadores de saúde e de proceder à vacinação a todos os cidadãos em qualquer lugar para garantirmos progressivamente um mundo livre da Covid-19. Muito obrigada.
Thank you very much, Honorable Minister. This is very exciting, and congratulations again to the country. So now, Professor Ampofo, we have always had this as a sticking question, so could you now tell us about how Africa is ramping up its capacities to manufacture vaccines?
Thank you very much for this opportunity. On behalf of my colleagues on the African Vaccine Manufacturing Initiative, we're very grateful to the WHO African region for inviting us to be part of this briefing. Although I know the focus is on COVID and the COVID vaccines, clearly COVID-19 has brought to the fore the real need and urgency to talk about vaccine manufacturing in Africa. I would like to thank Madam, the WHO Regional Director, Madam Moeti, for all the support that she has given to us in the past and recently, making vaccine production in Africa a major theme for the important public health response to COVID-19, which has highlighted the big gap in the ability for Africa to produce vaccines for itself. We must also mention the recent efforts by the African Union, the Africa CDC, who has also held specific conferences and actually organizing a conference very soon on vaccine production in the continent. By now, we should all know that there are very few vaccine manufacturing capacity in Africa. In our continent, there are only, I think there are less than 10 manufacturers based in 5 countries: South Africa, Morocco, Tunisia, Egypt, and Senegal, with very limited upstream production, mainly doing what we call packaging and labeling and fill and finish. So although we have several companies, about 80 of them on the continent, who can do sterile injectables, pharmaceutical production, this provides an opportunity, noting that in Africa, we usually use a primary dosage form. So there is the opportunity to really consider vaccine manufacturing as a major activity that will provide substantial financial, returns to the various countries in the different economic blocks if the vaccine supply and chain is well structured. Now, the other issue that we definitely need to focus on, that we cannot ignore, is that the current capacity of the countries that have some vaccine is mainly for internal supply. I can mention the example of yellow fever, which Senegal used to play a major role in, and that country is now retooling its vaccine production. And therefore, yellow fever production globally is actually very limited now. Now, if we look at how Africa sources its vaccines, most of Africa is supplied by UNICEF, supported by Gavi. There are very few countries that are self-sufficient in terms of vaccine procurement. So the market for vaccines in Africa is actually shaped, and managed by UNICEF and Gavi. And then we have some countries that are very few countries that are actually graduating from Gavi. And we really need to look at what kind of financial system would best be suited in place to enable us actually come up with a long-term strategy that would sustain, vaccine manufacturing. Now, the biggest impediment to this vaccine market is the way the market is structured. Okay, so we really need the continental bodies, the African Union. We need the regional economic blocs to take a very strategic view of how the regional blocs, how countries' interdependence, and the need for even the childhood immunization vaccines can be looked at, so that production would be geared towards supply, not just country, but regional needs, and establishing a system which sustain vaccine production. I recall one meeting I sat in WHO, and at the time, the Serum Institute was bemoaning the fact that they produced influenza vaccines which they could not sell in India. Now the Serum Institute is using its capacity to make the COVID vaccine, which is such an important tool in the current distribution of COVID vaccines. So we really need to look at the current system and see how we can review it and reshape it such that this complex issue of vaccine manufacturing, which requires huge financial investments and a long-term vision, is actually, established now on the current discussions that are taking place on the need for vaccines for COVID. So yes, there's a very important skill development. The regulatory issues are key. We cannot produce vaccines which are substandard. They have to be quality. They have to meet WHO pre-qualification standards. And we have to establish the technology, and we have to have the human resource. And most of all, we have to have the finance. Countries must step up. Governments must look at the issue. And I think it's high time that we look at the investment risk upfront and build vaccine manufacturing in a very manageable way. I would like to conclude by saying that the current COVID-19 pandemic presents a great opportunity to harness the various conversations and proposals into an action-oriented roadmap led by the African Union and the World Health Organization in Africa. And this will lead to increased vaccine production that will facilitate immunization of childhood disease, enable us to control outbreaks of highly infectious pathogens. We have Ebola rearing its head again. We have Lassa fever still going on in Nigeria and parts of West Africa. I'm very happy to announce that the government of Ghana has taken a big step forward, has mobilized, as the current leader of ECOWAS, has mobilized ECOWAS to set up a vaccine task force looking at, not just access to COVID vaccines, but also the production of vaccine. And the government has actually set up a vaccine production committee and instructed this committee to look at what are the issues, what are the strategies required to actually make vaccine manufacturing happen, in my country, Ghana. And I think this is a big plus. And this is something that reflects the current mood of many of the heads of states and many of the ministers, that we must find a way for the African continent to start producing its own vaccines. Thank you.
Thank you very much, Professor Ampofo. Indeed, we do have very good news right there with the many steps that have been taken. So now on a slightly different and equally important topic, we have Dr. Abdusalam Gay with us, the Regional Emergency Director for WHO in Africa, who will now update us on the Ebola outbreaks and other emergencies that we're dealing with in the region. Over to you, Dr. Gay.
Thank you, Fiona, for having me. As you may know, the Ebola outbreak was declared in DR Congo first, followed by Guinea. Today, we are at 32 days after the declaration in Guinea and 37 days after the declaration in DR Congo. And for both outbreaks, we have 30 cases, 18 in Guinea and 12 in DR Congo. And both of them have the same mortality rate of 50%. So far, with the collaboration with the two governments, WHO has helped vaccinate 35,000 people in Guinea and 1,600 people in DR Congo. And among those people, we have 1,100 health workers in Guinea and 175 health workers in DR Congo. Also, last week, we have the finding of sequencing that have some implication in terms of surveillance and in terms of management of Ebola in the world. Indeed, the sequencing for the first case of Ebola in Guinea have found that the virus is in general very similar to the virus that was the reason of the 2014 outbreak in West Africa. But as you may know, each time that a virus is changing host, it has some small change in its structure. And those changes can be measured. When we measure the change of the virus, we realize that it is in favor of a virus that was latent in a body for several years, which means that the virus that was latent for 5 years has infected another person or has relapsed from the person where it was hosted. It is very important because people may believe that the survivor of Ebola would be very dangerous to live with, and it may be the cause of stigmatization, but also as a health authority, we need to react to that and adapt our fighting strategy to that situation. Actually, after the Ebola outbreak in West Africa, a solid program was developed to follow the survivor. In Guinea, 88% of the survivor was into that program. And we follow them with the government of Guinea to test their body fluid and see the date when they're gonna have a clearance. It was not only in Guinea, it was done as well in Sierra Leone and in Liberia. Some studies that were done in Sierra Leone has shown that after 204 days, almost all females have cleared their body from the virus, and half of the men cleared the body from the virus. And when you go to 360 days, it was only 6% of the men that have virus in their semens. And it was followed more in Guinea, where after 512 days, it was only 0.05% of the men that has virus in their semen. It was very low. It does not mean zero. And the experience that we are following now has demonstrated that that low percentage should be followed and the program should be readapted and reinforced. WHO is working with those governments in order to reinforce those programs. We are also developing a task force to go further in terms of epidemiology, in terms of laboratory and bioinformatics, to see what we can learn from this experience and translate it into the program. At all cases, this program will need more resources and more attention from all partners and leaders. Over.
Thank you, Dr. Gay. And now that we've heard from all our panelists, it's your turn to ask questions. And to do this, again, use the question and answer function at the Zoom application on the right hand, at the bottom of the application. But also remember that we would like you to go live. And if you're ready to go live with your question, inform us when you want to do so, and we'll give you the opportunity. But for now, we shall have the first question from Ram Chakamba from Devets. You would like to ask your question, and I will send this to you, Dr. Moweti and the Minister, Honorable Minister from Angola. And the question is, do you think that the move by the European countries to temporarily suspend the use of AstraZeneca and the question surrounding its efficacy on variants will increase vaccine hesitancy in the countries rolling out this vaccine? And if so, what is being done about this? To you, Dr. Moweti and Honorable Tukuta.
Yes, thank you for that question. Yes, we are aware that a number of European countries have decided to pause their use of the AstraZeneca vaccine because of concerns, and as I said in my introductory statement, about adverse effects related to thromboembolism, to blood clotting. And this move, of course, the news about it has spread all over the world, certainly in European countries and very much also in African countries, both among the governments that have had to then look at this and in some cases make decisions about what they are doing, and very much around the general public. So to answer your questions, at the moment, yes, it would seem that many people are expressing doubts, and we've seen a couple of African countries also decide to pause for the time being their use of this vaccine. So there is concern that this could, if you like, fuel and add to doubts about vaccines, certainly doubts about this vaccine, the AstraZeneca. We hope sincerely, not doubts about COVID-19 vaccines more broadly. And just to add very importantly, as I said, there is work going on right now, and there already had been work going on to look at the data on adverse effects. And the European Medicines Agency has clearly come out recommending the continued use of this vaccine and indicating that as far as its examination of the data was concerned, there was no cause for concern because these adverse effects, the occurrence, if you like, the incidence of this of these manifestations was in fact lower than in the general population. WHO at the same time has also got a group of experts as part of our vaccines experts group looking at this matter. We've issued as WHO and the European Medicines Agency also issued statements indicating this position that the data at the moment is not definitive. The data is still being looked again today as we speak, and we expect very soon, certainly the latest during tomorrow, to have additional indications by these expert groups and advice that will guide countries on what to do. So what I'd just like to add is that we have also understood that a similar level of adverse effects has been seen in some of the other vaccines that have been emergency use listed. So for some reason, this has come out relatively strongly about the AstraZeneca vaccine. And we would really like to urge certainly our governments and the populations, let's wait, let's hear an additional point of view about this vaccine and then take the decisions that will be weighed up in terms of the risks of these adverse effects and the benefit of using a vaccine that is relatively efficacious against not using the vaccine in the context of the type of global supply challenges that we've already mentioned. Okay.
Thank you very much, Dr. Moeti, and to you, Honorable Tukuta, for your comments on the same. Okay, Honorable, you're still muted. Your microphone is muted. Could you kindly unmute? Thank you.
Já está?
Yes, we can hear you now. Kindly go ahead.
Ok. É uma pergunta bastante pertinente e queríamos aqui transmitir que Angola, à semelhança de todos os países no mundo, tem estado a acompanhar com atenção a polêmica que se gerou à volta da vacina da AstraZeneca. Também temos estado a acompanhar toda a investigação que está sendo feita, tanto pelas agências europeias como a própria Organização Mundial de Saúde e também tudo o que está a acontecer nos outros países. Em lugar de que os efeitos colaterais, os supostos efeitos colaterais, como o tromboembolismo, são mais frequentes até na população não vacinada, comparando com os casos que estão a ser estudados. Ainda não há, de facto, uma relação quer da Organização Mundial de Saúde, quer da própria iniciativa COVAX. Nós temos que pesar o risco e benefício. Nós temos que salvar vidas, temos que vacinar as pessoas e garantir que esta vacinação é feita com segurança. No nosso país temos uma equipa, uma comissão de farmacovigilância, que tem estado a prestar toda a atenção aos efeitos colaterais da vacina, e até aqui não tivemos registro de efeitos colaterais graves. Temos os ligeiros, como a febrícula, dores mioarticulares, náuseas em algumas pessoas, um pequeno inchaço no local da vacina, mas a mobilização continua a ser feita, as pessoas continuam a atender aos nossos postos de vacinação. E também há outro dado muito importante, foi abordado, e toda a gente sabe a nível mundial, que foi um lote em particular que está envolvido nesta polêmica. O nosso lote de vacinas da AstraZeneca veio, portanto, foi fabricado no Serum Institute e não é o mesmo lote que está ainda em estudo na Europa. Portanto, acreditamos, e como já tem sido relatado por muitos países europeus, que a suspensão foi apenas por precaução e nos países que receberam este lote em particular. Portanto, nós vamos continuar a seguir as orientações da Organização Mundial de Saúde, que recomendam o contínuo uso da vacina, sempre avaliando e monitorando os efeitos adversos e reforçando as ações de farmacovigilância, porque, como muito bem disse a doutora Moetti, não há, eu até ia mais longe, não há nenhum medicamento inócuo, portanto também não há vacinas inócuas, já foram registradas efeitos adversos com outras vacinas, também tiveram efeitos superiores, mas nós temos que olhar sempre para o risco-benefício e a necessidade que nós temos de salvar mais vidas. Muito obrigada.
Thank you very much for that reassurance, Honorable Minister, and I think we need to keep hearing voices from countries like yours, especially for Africa, to reassure the other African countries. So now, next, I would like to let you know that we also have Dr. Richard Mihigo with us online, and Dr. Mihigo is a coordinator for vaccine preventable diseases with WHO in the African region. Also, a reminder that kindly use the Q&A button function in the Zoom application and let us know right there if you want to go live with your question, as opposed to raising your hand, and you will be selected and given that opportunity to ask your question. So now I would like to go to Mapote Guy of Media 27. Are you ready to go live with your question? All right, so if Mapote is not going live, I will ask his question, and this will go to you, Dr. Richard. Have the experts of the World Health Organization conducted an investigation in the different countries that have taken the decision to suspend this vaccine, or at least have evidence that these countries have mentioned? Africa has doubts. What do we do now to reassure the African continent? And after Dr. Mihigo has given his comments, I would also like you, Dr. Moeti, to give your comments on the same.
Yeah, thank you, Dr. Fiona. I think that we have heard from both the WHO regional directors as well as the Honorable Minister from Angola. I think most of the vaccines that are currently being used in Africa are different from the lots that has been, or the batch that has been queried and currently distributed in Europe. The country that decided to pause for the vaccination in this region did it using a precautionary measure. So there is no evidence so far in those countries And most of these countries had not even started to conduct vaccination. So I think I would like here clearly to reiterate the already message that was sent strongly by the regional director that the use of this vaccine really, the benefits outweigh by far any perceived risk that we are seeing. Let's not forget that we are still, unfortunately, seeing people dying from COVID-19. So I think the risk is there. People are getting sick, people are dying. So all the means that we can use to prevent this disease, it's really very important.
Thank you, Dr. Mihigo. Dr. Moweti, we had a last part to that question. What are we doing? What can we do to reassure the African continent?
Yes, I think it's very natural that countries should be concerned, and I'd really like to commend Minister Sylvia Lutukuta and the Angolan government for the very deliberate analysis that they are doing, understanding very well. I think the minister articulated extremely well the kind of weighing up of options and risk and benefit that need to be done as these decisions are being made. What we are doing in WHO is to work on keeping in touch with the countries to provide them really in real time, as soon as we obtain it, any additional information that will help them in making these decisions. So, for example, last night I sent to all the WHO country representatives as well as our technical team the statement that WHO has released on this matter. I also sent them some key points, including information about what is known in terms of the data in relation to the side effects. So, because I know that they're on a day-to-day basis, as was said by the Honorable Minister, in touch with the governments, in touch with other partners who can be part of the conversation about decisions about this vaccine, so that we keep them informed and help them to think through and decide what to do. So this is what WHO is doing, in addition to our colleagues at the global level, looking at all the data that's available about the vaccines from the trials and the vaccine deployment that has been carried out worldwide, and updating this information and advice and guidance to countries as soon as it becomes available.
And all those efforts are definitely well appreciated. So we have our next question from Lohans Caramel from Le Monde, and this goes to you, Professor Ampofo. How many manufacturers on the continent have the technological knowledge and capability to produce COVID vaccines like AstraZeneca or Pfizer? And if TRIPS waiver proposal is approved by WTO? Over to you, Professor Ampofo. If TRIPS waiver proposal is approved by WTO, over to you, Professor Ampofo.
Okay, I was just typing a response as you.
If TRIPS waiver proposal is approved by WTO.
Okay.
Over to you, Professor.
Okay, I was just typing a response as you. Okay. Okay, I was just typing a response as you. There seems to be some playback of the previous sound. Is it okay? Should I continue? Can you
please go ahead. Sorry about that. Kindly go ahead, Professor.
Playback of the previous sound. Is it okay? Should I continue? Can you
please go ahead. Sorry about that. Kindly go ahead, Professor.
Okay. Is it okay? Should I continue? I've indicated.
Please go ahead. Sorry about that. Kindly go ahead, Professor.
Okay.
We do apologize for this. The IT is trying to work on this, and it will be solved just in a minute. We do apologize for this. The IT is trying to work on this, and it will be solved just in a minute. We do apologize for this. The IT is trying to work on Please go ahead, Professor.
Okay, I think it is okay now. So
please go ahead, Professor.
Okay, I think it is okay now. It is not okay. So
please go ahead, Professor.
Okay, I think it is okay now. It is not okay. So
please go ahead, Professor.
Okay, I think it is okay now. It is not okay. So
please go ahead, Professor.
Okay,
Okay, not sure if this is coming from which side this is coming from. So as we wait to have that question answered by Professor, I'll go to the next question, still coming from Laurence Caramel Lamont, and who has a question for the Minister, Honorable Minister Lutukuta. Coming from Laurence Caramel Lamont, and who has a question for the Minister, Honorable Minister Lutukuta. Coming from Laurence Caramel Lamont, and who has a question for the Minister, Honorable Minister Lutukuta. Okay, hopefully this has been solved. Okay, sounds good for now. So back to you, Professor Ampofo. Apologies for that. All right, so I'll now go to the Honorable Minister from Minister Tukuta, and we have a question again from Laurence from Le Monde. And the question, what is the cost for Angola to vaccinate 53% of the population? COVAX will supply a vaccine for 20%. So how will you fill the gap? And how have you, and do you have some bilateral deals with pharmaceutical companies?
Sim, muito obrigada. E uma pergunta bastante pertinente. Nós temos um plano ambicioso de vacinação com 2 etapas. A primeira etapa está de acordo com que a iniciativa COVAX pode cobrir 20% da nossa população e nós temos mais cerca de 33% da nossa população, que são todos os maiores de 16 anos até os 39 anos, que serão cobertos de várias formas. Recursos próprios do Orçamento Geral do Estado, nós também, o Estado está a mobilizar financiamentos, estamos a trabalhar com o Banco Mundial, com o Banco Europeu, e, portanto, desta forma e paulatinamente, pretendemos cobrir 53% da nossa população, que é a população elegível para a vacinação. Mas numa primeira fase queremos aqui reiterar que tanto pela iniciativa COVAX, quer pelas iniciativas do governo em contactos bilaterais e não só, nós vamos cobrir 20% da nossa população, que é a população de risco. Pessoas com comorbilidades, os muito expostos, que são os profissionais de saúde, temos também os professores, os idosos, pessoas idosas e com comorbilidades, e vamos, de facto, colocando de acordo com a disponibilidade de vacinas. Não sei se fui suficientemente claro.
Yes, thank you very much. You have done justice to the question. So we have our next question to you, Dr. Gay, and it's coming from Alex Winning at Reuters News Agency. And the question is, COVID-19 cases have been rising in Kenya, and the president has said ICU beds are filling up. Does the WHO Africa think this is due to the presence of the corona variant first identified in Britain, which the health ministry reported this week, or other variants? Dr. Abdul Salam.
The report we are getting from Kenya has shown that there is an increase in the number of cases and also in the number of deaths. We have also received a report for the presence of the variant that was initially reported in British. But we do not have evidence that the variants have a proportion that are big enough to be responsible of that increase. In all cases, the method to prevent and to detect and to respond to those viruses are the same. And WHO is working with the government of Kenya in terms of surveillance, laboratory, case management, risk communication, and community engagement, and all the pillars of the response. Over to you.
Thank you very much, Dr. Salam. The next question goes to you, Dr. Moeti, and still comes from Reuters news agency from Alex Winning. And the question is, you have mentioned the death of Tanzania's president and COVID-19 skeptic John Magufuli. Does the WHO Africa plan to engage with the Tanzanian government to urge a change in its coronavirus policy, including reporting data which was suspended in April last year?
Yes, thank you for that question. We have constantly been communicating with and engaging with the Tanzanian government on the measures to be undertaken, providing our advice on prevention, the public health measures, and of course, emphasizing the importance of sharing information so that WHO can share with other countries in supporting what's happening, in a sense, in a neighborhood around prevention together. What I can say is that we had observed in the last few weeks that some of the discussions around some prevention measures, including the use of masks, had started to shift in Tanzania. We, of course, will continue to propose, advise, and express our commitment and offer our support to the government and the people of Tanzania in getting on top of the situation. So in supporting, reinforcing the public health measures for prevention, I think it's already been said by my colleagues how very important these are, including in supporting the work towards acquisition of the vaccine by Tanzania for the population, and also including encouragement of resumption of reporting of cases for Tanzania to fulfill its international health regulations obligations as a member state, and also to know the situation and to enable the neighboring countries to know the situation. One of the most important features of the response to the pandemic has really been cross-border collaboration among neighboring countries, exchange of information, which greatly facilitates prevention on both sides. So we will continue in this endeavor to engage with the government, and we are very ready to provide support for their actions.
Thank you, Dr. Moeti. Our next question will come from Sarah Jeving from DEVEX. Sarah, please go live with your question.
Thank you so much. Mr. Mpofo, you mentioned that the Institut Pasteur in Senegal is retooling its facilities. Do you mean that they are retooling in order to produce COVID-19 vaccines? And are there any deals beyond the Aspen deal to produce COVID-19 vaccines in African countries? And then separately on Ebola, Africa CDC said today that community resistance is hampering the response in Guinea and DRC. I know a lot of work has been done to improve relationships with between responders and communities in previous outbreaks. So why do you think there is still community resistance? Thank you.
Thank you, Sarah. Do we have Professor back? Okay, once Professor comes back, we do have a number of questions for him. We shall give him the opportunity to answer your question. Thank you, Sarah. And now we have our next question from Emery Makumeno from BBC News Kinshasa. For countries that have suspended the rolling out of the AstraZeneca vaccine in Africa, to whom are we expecting to get the green or red light for the immunization campaign? This goes to you, Dr. Moeti and Dr. Mihigo.
Okay, thank you. I'll just say a word in response to the second part of the previous question about community resistance in the DRC and in Guinea. Just to say that we've observed every time at the beginning, in the early stages of these outbreaks, community resistance. I think we have learned over the years that one of the most important interventions right at the beginning of these outbreaks is to engage the community. So no longer start with an epidemiologist going to start counting the cases only, but understand immediately that the community plays a very important role in all aspects of preventing the further spread of the virus, and in some of the very unusual adjustments to the way of doing things, managing lives that have to be carried out in the context of an Ebola outbreak, including how we bury our dead, which is something that's very difficult for communities to adjust to. So it is not surprising, and it's something on which the governments in both countries have started to work already. I'm very well aware of the type of communication, outreach, working with community leaders, working with different networks, working with opinion leaders that is being carried out both in Guinea and in the DRC. And we've come to learn that this simply has to be a central part of every response to such an outbreak. And we would like for it to become a central component of the health systems and of the preparedness work that's going on, so that we don't start from scratch mobilizing people to talk to the community, but we already have links between the community and the health system that are simply triggered and reinforced in order to enable people to understand and to be able to play their part in enabling the control of the disease. Now, as to the suspension of the use of the AstraZeneca vaccine, I think our most useful tool is a careful analysis of the data, and then a very clear, transparent communication of the findings to various decision makers and also to the general public. It's important for people to understand, and we hope that people are coming to understand what a powerful tool vaccination is going to be to solving the dilemma of this wide-ranging, very unique pandemic that has affected health, education, economies, livelihoods, and life in general, the entire globe. So it's a big problem that needs to be addressed. And I think the minister expressed it very well. When we use medication of every type every day, there are always side effects that if you look at the labeling of any medicine that you will see written in fine print. So what we will do is very honestly, openly, as soon as it's available, provide the information, continue the effort of analyzing the data. And we're very encouraged that there is collective work done by the regulatory authorities, by scientific experts to put together the best knowledge to help governments and also to help people to understand what are the risks and, very importantly, what are the benefits of being vaccinated in a situation where I think we lost the professor for a moment, but I think he articulated so well the fact that there is a global problem of availability of these vaccines. And to have this tool, to use this tool is an opportunity that we must, if you like, postpone or reject when we are very, very clear that the risks far outweigh the benefit of deploying the vaccine.
Thank you, Dr. Moeti. I know we have reached the end of our time, but we still have so many questions, and we'll stretch it just by a few minutes to be able to answer as many questions as we can for you journalists, because we know this is quite an unusual time and you need to seek answers to give back to the population. And the professor is now back with us. So Dr. Mihigo, if you can give a quick comment on that, who will give a green or red light for these countries to continue?
Well, I think Dr. Moit explained it very well, and we heard from the Honorable Minister all the processes that country really do. And I think it's very important to mention that whoever gives that authorization, I think it's based on solid data, on science, on evidence, and the communication is transparent. So we have seen different processes across different countries, a recommendation by the national regulatory authorities, and ultimately the decision by the Ministry of Health. So I think the way we are recommending countries to use really the data, to use their evidence, to communicate in a more transparent way. And I think that's what will really bring the adhesion of the population to the vaccines.
Okay, Prof. Ampofo, we are very happy to have you back. Sorry, we know that technology does bring us issues all the time. But quickly, we had the question for you. How many manufacturers on the continent have the technological knowledge and capability to produce vaccines just like AstraZeneca and Pfizer are doing? And that was from Laurence from Lamont.
Yeah, I think that's a very difficult question because you'd have to look at the specific capacity that, and remember that Pfizer and Moderna have benefited from, I don't want to say billions of dollars, but several millions of dollars in the short, build up to when the vaccines were developed. You're going to have also received grants from those developed countries to increase their capacity per the increased demand for the vaccines. So we need to do a very important situational analysis of the current capacity in the countries that we know have vaccine production capacity already. But I think that if it could happen, it would have happened. So probably we don't have that, there are some big stumbling blocks to actually just transferring the technology and just starting the production in the countries in Ghana. In Africa. It's not that simple, I would say. And I think it's time that the governments, realize the big financial, investment that is required, and then also the guarantee of the market to sustain the vaccines once they are produced. We're talking about COVID now, but we need to understand that you can't just build a factory just to make COVID. You have to have a supply chain for the other vaccines that country or other countries in the sub-region would need and would commit to buy to sustain vaccine, manufacturing. So that's the big thing. It's not just, the technological know-how, it's also the market that would guarantee the sustainability and continuation of the vaccine manufacturing. You have to employ people. What would they do if there's no more COVID vaccine to produce? So in a nutshell, yes, just simple tech transfer will not solve the problem. Over.
Okay, thank you very much. You did justice to that one, but we had a final one from Devex that you missed while you were away, and you had mentioned that Institut Pasteur in Senegal is retooling its facilities, and is this start with the COVID-19 vaccines? And are there any deals beyond the Aspen deal to produce COVID-19 vaccines in Africa?
Actually, I think that COVID-19 has shown the potential that exists in Africa. The retooling in the Institut Pasteur, so far as I know, was to develop new facilities for yellow fever vaccine production. There's actually been a study funded by the UK looking at vaccine manufacturing potential in Africa. And I understand that the African Union will be working closely with the FCDO and other regional bodies to see how the findings from these studies could push forward vaccine manufacturing in Africa. There are, as I've mentioned, various, things like the Aspen, there are various, discussions and collaborations that are going on. And we hope that the African Union will come up with a roadmap, supported by WHO to ensure that we have the regulatory framework strengthening to ensure that these discussions and proposals actually become sustainable ventures for vaccine production in Africa. Thank you.
Thank you. Indeed, sustainability is something to think about. So we are coming to the end of this virtual press conference, and let's turn to our three panelists and hear any final messages that you have for us. And we'll start with you, Honorable Sylvia Lutukuta from Angola.
Em primeiro lugar, mais uma vez reiteramos a nossa satisfação em participar nesta conferência, em que foi feita uma abordagem holística sobre a situação das vacinas e não só. Tivemos aqui informação valiosa de outras doenças, que podemos até dizer endêmicas já no nosso continente, como ébola, e é importante aqui reiterar que em relação à vacinação temos que aumentar a nossa velocidade. Contamos com todo o apoio da Organização Mundial da Saúde dentro da iniciativa COVAX para acelerarmos o processo de distribuição e aquisição das vacinas. Achamos que este é o momento certo para expandirmos a vacinação, para evitarmos outras vagas e mais mortes. Nós temos que continuar a salvar vidas no nosso continente. Temos que também felicitar a África pelas medidas atempadas, reconhecendo a fragilidade dos seus sistemas de saúde, e vamos continuar a trabalhar juntos e encarar este desafio tão grande que tem um impacto social e econômico muito grande. Muito obrigada.
Very wise words right there. Thank you very much. And now over to you, Professor Ampofo. You've got a minute to give us your parting shot.
Yeah, I will just restate what I have said before, that it's great that the WHO African region are using this opportunity to talk about vaccine manufacturing. We want this to escalate, to the African Union. The Africa CDC is having a vaccine manufacturing seminar soon. We want a roadmap to be established. We at the African Vaccine Manufacturing Initiative will provide all the necessary support and do more advocacy to get heads of state in the African region, ministers of finance, ministers of housing, and ministers of industries, and ministers of health to really put vaccine manufacturing as a milestone in the next couple of years, so that we have sustainable vaccine manufacturing, so we don't have to beg for vaccines when there is an outbreak, and that together with the WHO, we can really push public health using vaccination as a tool for our people. Thank you.
We hear you well. And to you now, finally, Dr. Moeti.
Yes, thank you very much. First, I'd very much like to thank my two invited guest fellow panelists, Honorable Minister Lutukuta and Professor Ampofo, really for having shared your rich experience and knowledge with us and delivered very clear information and messaging on two key themes that are important for this all this work on working and using vaccines, acquiring vaccines and producing vaccines on the continent. I'd just like to say, following up on Professor Ampofo's remarks, that indeed this is a road on which Africans at different levels have been discussing for quite a long time. In 2007, we had the pharmaceutical manufacturing plan for Africa adopted by the African Union. And it has taken some time for this to translate. But I think along the way, we've learned a lot. I would like very much to echo your statements around investment and also the partnerships that will need to be put in place. At least one of the outcomes of this pandemic has been the expansion, the deepening of partnership, the private sector with governments, north to south. And we hope to have these types of partnerships emerge so that young African entrepreneurs can see the possibilities in the market in investing in vaccine production, because we do have a population, we have a growing young population that constitutes a market for vaccines in Africa. I'd like to say we've also had experience in pooling procurement, because you mentioned, and something I'd like to pick up on, that there needs to be a market created. We have a certain map in Africa. We can say that that's due to history. So we have a lot of countries. We have many small countries, each of which constitutes a market that's not very interesting. But we've had experience in working to pool procurement between countries and have learned what facilitates this pool procurement and what are some of the risks and challenges. I think we can also bring this forward in this effort to create the market together, and it'll inevitably have to be collectively done by African governments and countries in order to be an interesting market for investment as well. Apart from that, I'd just like to conclude again by saying, yes, we would like to continue to see equity and access to vaccines. We would, of course, have loved all the vaccines to be available on our continent in the way that we are seeing in other regions. The minister has indicated how the Angolan government is also looking and investing itself to supplement what is being done by COVAX. Within the COVAX platform, there are discussions about looking at revising and being more ambitious as far as the targets are concerned. And we hope very much for continued international support to make this a reality and to speed up to the extent possible reaching those levels in African countries that will make a difference in terms of reopening our economies and regaining life, the new normal, whatever that will be. And I'd like to conclude as usual by saying that while the governments and national leaders do our part, all of us as individuals have to continue to do our part to, when it's our turn, get out there and look for the vaccine. We will do our best to ensure that we put out information that ensures that the vaccines used are efficacious and are safe. And then secondly, to continue with the public health measures. Those will be necessary for some time. We all have to keep on with our masks, with our distancing, with our hygiene measures, using sanitizers, water, and soap. And we look forward to continuing the progression, the very positive progression now of our countries in vaccinating our populations. And I'd like to thank all our journalist colleagues for having joined us today. Thank you.
Thank you very much, Dr. Moeti, for that reminder that we have not yet done with the pandemic, so we need to keep on. So, reporters, we are really sorry. We have so many questions that have not been answered. In the chat, you've had an email address that has been written where you can send your questions and we'll ensure that they are answered. But for now, I would like to inform you that for our Francophone reporters, we shall have our experts, Dr. Abdul Salam Gay and Dr. Richard Mihigo, who will stay with us online for a few more minutes to answer your questions in French. Otherwise, thank you very much. Thank you, our panelists, and thanks for reporters for always joining us. And we do appreciate, and we cannot take this for granted. Have a good day.
Thank you very much for having me.
Bye-bye. Thank you.
Ok, on va commencer la session francophone, je crois.
Bien, bonjour à tous. Nous avons effectivement beaucoup de...
je pense qu'il y a Vincent Defay qui va demander des questions.
Oui, je suis là. Donc, nous avons un certain nombre de questions de journalistes francophones. Pour y répondre avec nous, nous avons donc, comme il a été dit, Dr Mihigo, coordinateur du programme de vaccination, et le Dr Salam Gay, qui est directeur de la préparation aux situations d'urgence. La plupart des questions que nous avons concernent les vaccins, la vaccination et la sécurité des vaccins, en particulier celui d'AstraZeneca. La première question nous vient du journal Le Patriote de Côte d'Ivoire qui demande sur quelle base l'OMS recommande l'utilisation de ce vaccin. Et cette question rejoint celle de France Info qui demande que recommande l'OMS aux pays africains sur la conduite à tenir sur le vaccin AstraZeneca, notamment les pays qui ont mis en pause leur vaccination comme la RDC. Monsieur Mihigo, Dr Mihigo peut-être?
Oui, merci beaucoup pour ces deux questions. Donc, très rapidement, sur quelle base l'OMS recommande ces vaccins? Je voudrais ici préciser qu'il existe un processus extrêmement rigoureux qui est suivi dans la revue, mais également l'homologation des vaccins à travers un système de préqualification qui existe maintenant depuis pratiquement 2 décennies au niveau de l'OMS. Donc, nous recevons les dossiers complets des données de vaccins qui demandent une certaine homologation. Ces données sont revues par un groupe d'experts internationaux qui regardent de manière transparente les données telles que publiées dans les essais cliniques, la revue de la littérature par rapport à tout cela, et un avis scientifique, une recommandation est faite pour éventuellement recommander ou pas à l'utilisation de ces vaccins. Donc, pour ce qui concerne les vaccins actuels en cas d'urgence, il existe un protocole spécifique qui a été développé dans ce sens après cette revue des données disponibles pour le moment, une analyse approfondie. Les vaccins sont listés pour une utilisation dans des circonstances d'urgence et les pays utilisent cette recommandation de l'OMS pour éventuellement, à travers les autorités nationales de réglementation, autoriser ou pas la vaccination avec ce produit dans leur pays respectifs. Alors, pour ce qui est de la conduite à tenir, pour les pays qui ont pris une pause, je voudrais ici rappeler que la plupart des pays ont pris cette décision, pas en fonction des données qui incriminent ou pas le vaccin, mais la plupart de ces pays ont pris, et d'ailleurs on l'a vu dans les pays européens également, par mesure de précaution. Donc, et comme on l'a discuté tout à l'heure dans la conférence, nous avons pour le moment l'Agence européenne des médicaments, mais également le comité consultatif de l'OMS pour la sécurité des vaccins, qui est en train d'analyser toutes ces données qui remontent de ces cas de thromboembolisme qui ont été notifiés, et éventuellement une recommandation d'abord qui a été réaffirmée non seulement par l'Agence européenne des médicaments, mais également par l'OMS, pour la continuation de la vaccination, parce que nous estimons que les bénéfices sont largement supérieurs aux risques que les personnes doivent encourir. Donc, spécifiquement pour ces pays-là, nous sommes en train de travailler avec eux, nous sommes en train de discuter avec les autorités nationales pour éventuellement leur fournir toute la documentation et l'appui nécessaire à ce que des décisions idoines soient prises pour le bien-être des populations.
Merci, Dr Mihigo. La prochaine question nous vient de Jeanne Richard de RFI, qui mentionne le fait que le Cameroun a aussi mis en pause sa vaccination. Y a-t-il d'autres pays en Afrique qui retardent leur campagne de vaccination à cause de doutes sur le vaccin? Et surtout, est-ce que cela remet en cause la distribution de vaccins par le mécanisme COVAX?
Non, absolument pas. Bien sûr, nous avons bien entendu appris la pause, si on peut dire ainsi, en RDC, mais également le Cameroun. Bon, nous avons également des informations par rapport au Libéria, qui a également reporté les débuts de la campagne, en Namibie, mais également en Guinée-Bissau. Mais tout ceci, effectivement, ne remet pas en cause, parce qu'il faudra affirmer que parmi les 38 pays qui ont reçu des vaccins au niveau du continent africain, 30 de ces pays ont reçu des vaccins de AstraZeneca. Donc, la grande majorité des pays ont reçu ces vaccins. Et ceux qui ont commencé à vacciner, le gros des pays qui ont commencé à vacciner le font avec les vaccins AstraZeneca. Et d'ailleurs, dans la plupart de ces pays, comme nous l'avons appris aujourd'hui à travers l'Angola, la vaccination continue de manière normale. Donc, nous ne voyons pas de risque particulier pour le dispositif COVAX, d'autant plus que la recommandation de l'OMS est très claire là-dessus. Nous devons continuer à utiliser ce vaccin jusqu'à nouvel ordre, parce que nous estimons que les données actuelles sont largement en faveur de bénéfices que confère ce vaccin par rapport aux risques qui sont en train d'être évalués.
Merci beaucoup. La prochaine question est de Christiane Munoki-Ekambo du Journal des Nations en RDC, qui nous dit « Nous constatons une stabilité du nombre de cas de Covid-19 avec une propagation faible. La majorité des cas sont asymptomatiques. Dans cette mesure, quel sera l'apport d'une campagne de vaccination à grande échelle dans un pays comme la RDC? Est-ce que c'est vraiment indispensable, étant donné le rythme de diffusion de la maladie?
C'est une question extrêmement intéressante. Il faudra d'abord préciser que par rapport à ce que nous appelons la stabilité de cas, etc., on sait bien que la plupart, malheureusement, de nos pays ne testent pas suffisamment pour avoir une idée réellement précise de la circulation du virus. Et ça, ce n'est pas nouveau, hein. Ça fait depuis 1 an que nous voyons cette situation dans la région africaine où le taux de tests au niveau des pays est faible. On a longuement parlé de la sous-évaluation dans certains pays de la pandémie, mais il est clair également que beaucoup de cas, la majorité des cas qui ont été rapportés dans les pays restent asymptomatiques. Mais il ne faudra pas oublier que cette maladie, que ce soit en RDC d'ailleurs, et les données le montrent très clairement, continue malheureusement à tuer des gens. Et au-delà de l'aspect santé publique, nous avons vu que cette maladie et cette pandémie a également des conséquences non seulement sanitaires, mais également économiques, sociales et sociétales de manière générale. Donc, la vaccination a réellement une place importante dans le processus d'un retour à la vie normale, d'un retour de l'économie de nos pays sur les rails, d'un retour sur les interactions sociales dans nos communautés. Et sans un vaccin, sans un processus qui va protéger de manière durable les personnes, il va être très difficile de revenir à la vie d'avant. Donc, nous continuons à recommander à ce que le vaccin soit largement utilisé dans les pays pour non seulement prévenir les cas graves et les décès, mais également pour permettre la réouverture rapide de nos économies, de notre vie sociale, de nos frontières et que la vie d'avant puisse reprendre dans les meilleurs délais.
Merci, docteur. Une question qui nous vient du magazine Osmose de Côte d'Ivoire, qui demande si les pays qui ont commencé à déployer le vaccin AstraZeneca ont mené des enquêtes, d'abord au sein de leur pays, avant de l'administrer à leurs citoyens, ou avant d'en faire la publicité ou de le proposer à la vente. Est-ce qu'il y a eu je pense que vous avez commencé un peu à répondre.
Vous pouvez parler un peu à haute voix, je vous entends difficilement.
Ah, pardon. C'était une question qui nous vient du magazine Osmose de Côte d'Ivoire qui demande s'il a d'abord, les pays qui ont déployé le vaccin ont d'abord mené des enquêtes de terrain auprès de leur population avant de l'administrer.
OK. Peut-être pour répondre à cette question, je voudrais un peu revenir sur ce que j'ai dit à la toute première question sur quelle base les vaccins sont recommandés. Comme vous le savez, lors des essais cliniques, nous avons un large échantillonnage des personnes qui sont enrôlées dans les essais cliniques et suivies non seulement pour vérifier la sûreté des vaccins, mais également pour vérifier l'efficacité et l'innocuité de ces vaccins. Donc, il existe un processus extrêmement rigoureux qui est appliqué dans tout processus d'essais cliniques, avant même qu'on arrive au stade où les données sur la sécurité, l'innocuité et l'efficacité des vaccins puissent être publiées en fonction des essais cliniques. Alors, il n'est pas nécessaire que chaque pays puisse à son tour conduire des enquêtes ou des essais, parce que lorsque le vaccin a terminé les phases d'essais cliniques et que le vaccin a été analysé de manière rigoureuse par l'OMS et qu'un avis favorable a été donné, généralement, nous travaillons maintenant avec les pays pour que les autorités nationales de réglementation de ces pays-là puissent à leur tour porter, non seulement regarder ces données, mais également faire des recommandations à leurs propres autorités nationales de réglementation. Pour le cas de la Côte d'Ivoire, par exemple, avant l'arrivée de vaccins, l'autorité nationale de réglementation a bien entendu donné son aval pour que ce vaccin arrive dans le pays. Et en plus de ça, il y a une étape importante qui suit, c'est la pharmacovigilance, où nous mettons en place un système qui va suivre les personnes qui ont été vaccinées et éventuellement voir s'ils ont eu des effets secondaires suivant la vaccination ou pas. Et je pense que c'est tout cet ensemble-là qui confère beaucoup certitude, je dirais beaucoup de garanties au pays pour être sûr que les vaccins puissent être déployés sans réel danger dans la population générale.
Merci beaucoup. Peut-être la dernière question, un peu plus factuelle, celle-ci. Combien de doses du vaccin AstraZeneca ont été ce jour distribuées en Afrique via le mécanisme COVAX, pardon, et ce vaccin est-il aujourd'hui le vaccin majoritairement utilisé sur le continent?
OK. Nous avons, à la date d'aujourd'hui, 16 millions, 16,3-4 millions de doses de AstraZeneca qui ont été distribuées à travers l'initiative COVAX à 27 pays. Donc, ça reste de loin le vaccin qui est le plus utilisé. Comme je crois que je ne sais pas si je l'ai dit, mais sur les 38 pays qui ont commencé la vaccination de manière générale en Afrique, 38 pays, 30 de ces pays utilisent déjà le vaccin de AstraZeneca. Donc, il y a des pays en dehors de l'initiative COVAX qui sont en train d'utiliser ce vaccin, soit à travers des dons qu'ils ont reçus de l'Inde ou du Sérum Institut India, ou bien à travers des achats bilatéraux qu'ils ont fait uniquement. Donc, ça reste le vaccin, pratiquement 90% qui soit utilisé dans la région, qui est utilisé actuellement dans la région africaine.
Merci beaucoup, Dr Richard Méhigo. Je pense que nous allons conclure là-dessus, à moins que vous ayez peut-être quelque chose en plus à dire.
Non, je voudrais encore une fois remercier les journalistes, mais insister sur un fait. Je pense que nous sommes dans une période, c'est vrai, cruciale, où, comme on l'a entendu, le doute, l'incertitude est en train de gagner du terrain à cause de toutes ces mesures de suspension qu'on a vues dans les pays européens. Mais je voudrais ici réitérer encore une fois le message de l'OMS, le message corroboré par l'Agence européenne des médicaments, mais également la plupart des régulateurs au niveau des pays dans notre région, pour réaffirmer que les bénéfices réels de ce vaccin, mais également au-delà de AstraZeneca, de la vaccination de manière générale, telle que nous l'avons vu aujourd'hui, sont largement supérieurs à des risques qui peuvent éventuellement émaner de ça. Et nous voulons saluer les pays qui continuent à protéger leur population. N'oublions pas que nous sommes, on l'a entendu, peut-être au début d'une troisième vague, et il faudra absolument que nous puissions protéger les personnes les plus vulnérables avec les outils que nous avons actuellement dans cet environnement où nous n'avons pas suffisamment de doses de vaccins. Mais l'OMS ne transigera jamais sur la qualité. Et lorsque des recommandations sont faites dans ce sens-là, nous espérons que les pays vont continuer et ceux qui ont mis en pause, éventuellement, reprendre la vaccination dans les meilleurs délais pour protéger des vies et éventuellement sauver notre système de santé et nos économies de cette crise énorme qu'est la pandémie à Covid. Je vous remercie.
Merci beaucoup, Dr Méhigo. Merci à tous les journalistes d'être restés un peu plus longtemps avec nous. Je pense que nous avons répondu à la plupart des questions. Et il ne nous reste plus qu'à vous souhaiter une bonne fin de journée, en espérant vous revoir la semaine prochaine pour la conférence de presse de l'OMS. Merci.
OK, merci beaucoup. Au revoir.